30 of the 31 Days of BPD. Today I'm going to be sharing with you some information about therapies available and what medications you might kind of either be prescribed, or you may think that you want to take them. Whatever your situation, I'm going to try and cover as much of that here. It is it's a very big topic. I will be talking about medications on a separate video outside of the 31 days, but I wanted to just try and make it a really specific video so that if you have just been diagnosed, or you haven't received any treatment or meds or anything like that, then all the information will hopefully be here. I've referred to and talked about the STEPS course a few times. Now, I haven't explained it fully in the other videos because I wanted to save it for here. STEPS is a therapy course. It runs for about 6 months. It's once a week for 2 hours, and it's psychoeducational. So you're learning about the therapy, you're learning about your illness, and you're learning about how to apply these new ideas to your illness. So you remember we talked about the distance, communicate, challenge, distract, and manage problem. Well, that is taken from STEPS. Now, STEPS is an acronym, and it stands for Systems Training for Emotional Predictability and Problem Solving. Now, I did this as part of a group, and I found that really, really useful because when you're first learning about your illness, when you're first diagnosed, and this goes for all mental illnesses, when you're in a group situation and you see other sufferers, not that you want to see anyone suffering, but when you see other people that have your same illness, you feel like you're not the only one. You feel that you can actually connect with other people on a level that maybe you've never been able to with other people. I'm very lucky. I did both the STEPS course and the Stairways. I'll talk about that in a minute. And on that course, I've met friends for life. And my BPD friends, my ones I met on my course, my love goes to you guys. It's been really great being on the same journey together. So if you can get on the STEPS course, you really do need to in order to do that, you first of all need to have a diagnosis of BPD. You secondly need to be either in the care of your local mental health clinic, or already been referred to some sort of psychotherapist or psychiatrist. Because my psychiatrist that I met when I was diagnosed said, you need to get on this course, it's brilliant, it's really, really good for people with BPD, and it has been really, really, really beneficial. So STEPS was the first part, and I've referred to a lot of the stuff in this course. So as I said, the distance, communicate, challenge, distract, manage, problem, that is all taken from STEPS. Now, what I've done for this first series of 31 Days of BPD is mainly refer to the STEPS course, but there is also the Stairways course which follows on. So you'll do like a sort of 6 months to a year for the first one, and then Stairways, that is over a year, and it is every other week. But you still have the same amount of sessions. I think it's about 20 to 24, something like that. And Stairways is the next phase after STEPS. So you do STEPS, then you do Stairways. And Stairways is another acronym, and this one's a bit longer. So I'm just going to, excuse me looking down whilst I read this out. So Stairways: setting new goals, trying new things, anger management, impulsivity control, relationship management, writing a script, assertiveness training, your choices, staying on track. So when you've done the first one, the STEPS, you'll get a lot of really good baseline stuff. So you'll be learning how to distance, communicate, challenge, distract, manage, problem, and you'll also be learning about setting goals and things like that. But the Stairways, we kind of progress a bit more, and I found really, really useful on the Stairways course the anger management and the impulsivity control. But I want to be honest with you guys and say that yes, I can tell you all these wonderful things to do and help you and guide you as much as I possibly can, but I still have bad days. I still have days when I reach for things I shouldn't. I still have days when I self-harm. I still have days where I cannot control my moods or my emotions, and I have days where I dissociate, and even times when I go into absolute sheer panic over the smallest of things. Steps is very, very good because it helps you start to develop new ways of thinking, new ways of talking. It's also called Dialect Behavioural Therapy, or DBT, because it's sorry, I hit the microphone. It's asking you to use your different ways of, different language. We talked about using distancing words, challenging words, communicating. All of these things is kind of using your dialect, using your language to help you understand your therapy. Just to finish on the steps and stairways, that was created by Nancy Bloom and Bruce Foll. I'll put that information in the description below. And it's been running for quite some time now. If you can get on it, this is great. If you can't, there is another course that would be useful. I mean, it's not as good as the DBT, the steps and the stairways, but cognitive behavioural therapy, or CBT, that is really good, especially for managing your anxiety and depression. In fact, I would say I personally think that CBT should be taught in schools. Maybe not to the deepest levels that this goes to, but I really think this is something, because it teaches you how to spot your negative thinking behaviours, your negative... Big fly just came over it. Your negative thinking, your negative behaviours, and your negative emotions. It tells you how to kind of work with one, and it basically helps you to focus on how you're... So I'm going to read it out because I've just completely messed up what I was going to say. Talking therapy that focuses on how your thoughts, beliefs and attitude affect your feelings and behaviour, and teaches you coping skills for dealing with different problems. So if you're having anxiety, it'll teach you coping mechanisms to deal with your anxiety, to deal with your depression, and so forth. This isn't specifically for people with BPD, unlike the steps and the stairways, but it is really, really good. So if you can't get onto the DBT, the steps and stairways for a while, then ask if you can go on a CBT course. That can also be run in a group, and that can also be done as one-to-one sessions. Other therapies available are your one-to-one private kind of counselling therapy sessions, or in a group dynamic. It really does depend on you. Have a look what's out there and speak to your psychotherapist, your therapist, your psychiatrist, whoever you can, or even your GP, even your doctor, and say, I really need to go on this course. You can get a lot of the information for the steps course online, but you do have to pay. But, some people that's not an issue. I tend to be broke all the time, but, some people can. So I've put the information for all the steps and stairways and CBT in the description below. I'm now going to quickly talk about medications, if I can find my piece of paper. Yes. So if you have BPD, you are very likely to have depression, anxiety, negative or distorted thinking. So you are likely to be prescribed antidepressants, anti-anxieties, antipsychotics, mood stabilisers. I'm on an antipsychotic called quetiapine. Some people hate it, some people love it. Quetiapine, unfortunately, you do get some weight gain. It does make you want to eat more, so you do tend to put on a bit more weight, which is great when you have body dysmorphic disorder or an eating disorder. So antipsychotics are really, really good. They stop the the negative thought spiral. They can stop you from dissociating. They can stop you from going into a really bad place. They do have side effects, as with all medications. For example, some antipsychotics can completely knock you out. Quetiapine is one of them. I have to make sure I take that at the right time, otherwise I'll start falling asleep. And it is like that. Other antipsychotics, really focus on sort of not necessarily sedating you, but working, in a different way. I'm going to do a whole video on medication. I'm not going into detail now. I apologise. I'm just saying that some of the things that you might be offered. I would say if you are offered an antipsychotic, ask what it is, make sure you find out a bit more about it before you take it. Look into the side effects as well, bearing in mind that with any medication it takes a while for it to kick in. It's not going to kick in straight away. Some people say it takes 2 to 3 weeks. I personally, for me, it seems to take a bit longer. Other people, it can work within a week. It depends on you, it depends on the dose. What we need to do is make sure that you're on the right meds for you, and sometimes that can take a while because, you know, it might not work straight away, it might not, you know, whatever, so it might not work for you first time. So as antipsychotics, mood stabilisers, I actually don't take any of these, but so if someone can comment on mood stabilisers in the thing below. But again, these will act in the same sort of way, trying to keep you level, trying to keep you from going into your you know, off the scale. I haven't got that notebook with me, so I can't show you my little diagram, but yeah, you know, we want to stop your levels from going up. But yeah, mood stabilisers, I'm doing a lot more research into them, and I'll be producing some videos later on in the year about medications. So this isn't your only medication place. Antidepressants, really, really good. I take an antidepressant. I take duloxetine, but that's been my third antidepressant. First set just didn't work, didn't touch it, because I have major depressive disorder. I mean, when I have that, I'm not depressed all the time, but I can have, you know, bouts of it when it will last, you know, a few days, sometimes maybe a week. There's also anti-anxiety. These are really good. So you'll hear things such as pregabalin and things like that. Anti-anxieties are, I don't take any anti-anxieties because my antipsychotic has anti-anxiety properties in it as well. But anti-anxieties are really good. They may give you things like beta blockers, which is what pregabalin is. So it kind of slows your heart rate down. I personally haven't taken those because I know it's another weight gaining drug, and you will realise that quite a lot of them are, which is very frustrating, but it's just more of the side effects. Unfortunately, we're put on meds for way too long, and you know, being on meds for years and years and years can actually reduce your life expectancy, but sometimes you need them. And in fact, actually, if you are prescribed them, make sure you take them, because if you were given, you know, medication for your heart, if you had a heart disease, would you take it? You probably would, because you wouldn't want anything bad to happen to your heart. But for some reason, I don't know what it is, but with medication, it is something that people feel either scared to take, and that's fine. If you're just taking meds the first time, then that's going to be pretty intense as well. I'm going really off the track from where I'm supposed to be talking. But yeah, so there's therapies available, and there are meds that you can take. Hopefully I've given you a nice introduction to some of that. But when I do the next 31 days of the next 31 days of BPD, I will be talking more about that side of it, and keep a lookout on the blog for more information about meds. Thank you for watching today. I hope that you found some interesting information. Please put any comments or questions that you have in the space below regarding any therapies that you've done, what worked for you, what didn't work for you, what meds are you on, can you tell me about your mood stabilisers or your antipsychotics. Thanks for watching. Please like and subscribe. I think I already said that, but never mind. Please like and subscribe if you